So as far as recovery goes for the ICL procedure, recovery, like post-op information is that they give you these like tears, like artificial tears that you need to put in. They told me 4 times a day, and then they gave me this steroid drop. It's the steroid drops that I have to put in 3 times a day, and that's going to help with healing and inflammation. They gave me these shields. I had to ask for these, so you should know what you're asking for. I did a lot of research before my procedure, but these are basically put on like this. This part goes above your nose, and you tape this on for sleeping. And they gave me a bunch of tape. So you tape these on so that you can sleep and not accidentally touch your eye, or like I tend to sleep on my side, and so I might like squish my eye. You definitely don't want to be doing anything like that after your procedure. So as far as the drops go, you want to really make sure you understand everything before you go into the procedure, because after the procedure, the nurse is not that familiar with ICL, and she might not know exactly what you need to do. The surgeon definitely does know, but you need to ask. You may or may not get to see the surgeon all that much, and you may or may not be that coherent, you know, like how are you going to be feeling after the surgery? So I'm really glad I checked everything out beforehand. Also, they had originally given me these sunglasses, and these, you know, don't offer that much protection. If you look at these, they're just like normal sunglasses. So since I had already seen on YouTube some people who had gotten this procedure done, thanks to those people, I knew this isn't right, so I told them, you know, it's supposed to be something different. It's supposed to have some sort of like, see, it's got protection up on top here, and it's got protection on the sides here. So it's like, and it's even got protection on the bottom here. So it's definitely a different thing. So like inadvertently, I might want to rub my eye or like scratch my eye or something, and I can't, and I remember that these are here. So I'm wearing these definitely for the light sensitivity and everything. I'm not wearing these ones, maybe later, but I have sunglasses already, so why would I wear these? But these are definitely really important to have. You want to make sure you're following all the post-op stuff. Another thing is they only gave me like 15 doses of these drops, so I'm going for a follow-up today, day 1, and I'm gonna have to ask them for more, because, you know, will they remember to give that to me? So you really need to be on top of your stuff. I think for most people, they're not that health literate or in this country, so you really have to just really have to do your research and know your stuff. Like, thankfully I'm a pharmacist, so I have a little bit of, you know, some sort of educated, I'm somewhat educated with the healthcare system, so I can kind of ask them and like find out how many drops is it, how often is it. I can find out a little bit more. I kind of know what I'm supposed to be expecting a little bit, but I don't know if like my mom or my dad would be able to do that. I think they really need a lot more in-depth information. Even the paper is not that clear that they've given you. So just make sure you ask all that stuff before your surgery, and everything that they give you, take a look, make sure you have enough of everything. You have like the correct glasses, because most of these procedures, you know, they're doing like cataract surgery or they're doing other things. They're not familiar as much with ICL, because I was definitely like the only ICL patient there, and I think that's like, they're like, oh, who is this young person here? Like they didn't even understand why I'm getting surgery. Like some of the people were confused, because most people are like much older getting cataract surgery, and it's not the same thing. And I'm like younger, so it's definitely a different experience, and they are not as familiar with it either. So yeah, hope that helps. So that's like the post-op information that I have. You do so a post-op visit the same day right after the surgery to check everything out. Like they're going to check the pressure in your eyes, and they check the placement of the lens. They're going to check some stuff today. I'll find out more about that today. That's a 1-day appointment. And then there's a 1-week appointment, 1 week post-op. And then there's a 1-month post-op appointment. And so it's supposed to gradually get better with time.